Within the last week, the White House has dropped a bombshell. Standing alongside Robert F. Kennedy Jr., the Trump administration declared that pregnant women should not take Tylenol, warning that acetaminophen use during pregnancy could be linked to autism in children. That statement isn't small. Tylenol, or acetaminophen, is most commonly used during pregnancy. Studies suggest that roughly half of all pregnant women take it at some point for a fever, headaches, or pain. For decades, it's been considered the safest option, especially since alternatives like ibuprofen are known to increase risk of complications and birth defects. So when a U.S. president stands at a podium and tells expectant mothers, don't take Tylenol, it creates shockwaves. But the real question is this a case of new science forcing us to rethink old assumptions, or is it another example of politics oversimplifying and overstating the research? That's what we're going to investigate today. We'll break down exactly what the administration said, what the evidence actually shows, where experts agree or disagree, and ultimately whether Tylenol really poses a danger during pregnancy, or if this is just another spin story. Segment 1. What the White House claimed. At the press conference, President Trump didn't mince words. He said, quote, "If you're pregnant, don't take Tylenol." He went on to say that groups of people who don't use medications or vaccines also have no autism, and that we're pumping too many chemicals into beautiful little babies. Now let's pause here. That's a very strong statement, and it's being delivered alongside Robert F. Kennedy Jr., a longtime critic of vaccines and pharmaceutical products. The administration also put out a fact sheet claiming there's mounting evidence linking Tylenol in pregnancy to autism and ADHD, and that the FDA would add a safety label warning. Specifically, affiliates like Sinclair and Nexstar reported that health officials are pointing to a large-scale cohort study, systemic reviews, and so-called gold standard meta-analysis from Harvard and Mount Sinai. They framed it as proof that acetaminophen is not as safe as we thought. The FDA has said they'll issue physician alerts, update labeling, and investigate further. On the surface, it sounds like the government has solid evidence and is making a proactive move to protect children. But was that statement, "Don't take Tylenol," actually supported by the science? Or was it political messaging that went far beyond what researchers themselves are saying? Segment 2. The studies being cited. So let's break down the evidence the White House has leaned on. First, the Boston Birth Cohort, a Johns Hopkins study from 2019. Researchers tested acetaminophen levels in umbilical cord blood. What they found was a clear pattern. Babies with the highest exposure had 3 times the risk of being diagnosed with autism or ADHD compared to those with the lowest exposure. That's a dose-response relationship, which always grabs attention because it suggests that the more you're exposed to, the higher the risk. Second, there's the Nurses' Health Study 2, a long-running study tracking thousands of women. It found that women who used Tylenol during pregnancy had a higher chance of having a child later diagnosed with autism or ADHD. And then there's the new 2025 Systemic Review published by BMC Environmental Health, funded by the NIH. This review pulled together 46 studies worldwide and concluded that there's supportive evidence of an association between prenatal acetaminophen use and neurodevelopmental disorders. The authors even pointed out that higher quality studies were more likely to find a connection. They suggested biologically plausible mechanisms. Tylenol can cross the placenta, it can cause oxidative stress, and it can disrupt hormone pathways and potentially alter gene expression in the developing brain. Those are not small claims. That's why the White House leaned on it, because at first glance, it looks like a mountain of evidence piling up against Tylenol. But here's the important detail. Every one of those studies stopped short of saying causation. They used terms like association, link, or increased risk. That's not the same as proving that Tylenol directly causes autism. And that's where the nuance gets lost when it's turned into a headline or a soundbite. Segment 3, the counter evidence. No causal link. Now let's look at the other side, the studies that dig a little deeper. In 2024, researchers in Sweden published one of the largest studies ever on the question in JAMA. They studied over 2.4 million children, comparing those whose mothers took Tylenol during pregnancy to those who didn't. At first, they saw a slight increase in autism and ADHD diagnosis among exposed children. But then they applied a clever method, sibling comparisons. They looked at families where one child was exposed to Tylenol in the womb and the other child wasn't. If Tylenol were a true cause, you'd expect the exposed siblings to have higher rates of autism. But that's not what they found. The difference disappeared. In other words, the small associations they saw in larger populations could be explained by other factors such as genetics, family environment, or the reasons why the mother took Tylenol in the first place. This sibling study is powerful because it controls for confounders most studies can't account for, and it found no evidence of causation. And that's the trend. The bigger and more rigorous the study, the weaker the evidence for a causal link becomes. Many experts now believe that what we're seeing is correlation. Women who take Tylenol during pregnancy often do so because they have fevers, infections, or inflammation, conditions that are themselves associated with increased risk of autism. So is it the pill or is it the illness? That's the million-dollar question. Segment 4. What experts and medical groups say. Mainstream medical organizations haven't changed their guidance. The American College of Obstetricians and Gynecologists says acetaminophen remains the safest first-line option for pain and fever in pregnancy. The Society of Maternal Fetal Medicine agrees. And the FDA itself, while adding cautionary labels, has made clear that Tylenol is still reasonable to use while clinically needed. Doctors worry that scaring women away from Tylenol could backfire. Why? Because untreated high fevers during pregnancy are known to cause serious complications, including neural tube defects. And alternatives like ibuprofen and aspirin are actually dangerous to fetal development. So if pregnant women stop taking Tylenol out of fear and not end up treating a 102-degree fever, the risk could be much worse. Experts even stress that even if Tylenol has an effect, it would only account for a fraction of autism cases. Autism is primarily genetic, with dozens of genes involved, plus other prenatal and environmental factors. To frame Tylenol as the cause oversimplifies a very complex condition. Segment 5. The spin and the truth. So how should we view this? The data shows some associations, enough to warrant further study and to remind us that no drug is 100% risk-free. But the best science we have right now does not prove that Tylenol causes autism. At most, heavy or prolonged use might contribute to a small increase in risk. At the worst, the entire link could be explained by other factors like infections during pregnancy. What the White House did was take a nuanced, complicated body of evidence and boiled it down to one blunt message. Don't take Tylenol. That might play well politically, but it's not scientifically accurate. The truth is in the middle. Pregnant women shouldn't be scared away from safe treatments, but they also shouldn't use Tylenol casually for every ache and pain. The smart approach, use it when you need it at the lowest effective dose and always under a doctor's advice. That's what the research really supports. In the end, autism isn't caused by one simple factor. It's a mix of genetics, prenatal conditions, and possibly some environmental exposures. Tylenol may or may not be one of those pieces, but the evidence today says it's not the smoking gun. So is Tylenol safe? Used properly? Yes. Should we be cautious? Absolutely. But claiming it outright causes autism is a spin. They spin the story, we uncover the truth. This is the Spin Detective.